when chemotherapy, surgeries, and all that can be done safely. The blood level of the person can take the chemotherapy. Most of the times here, people come in terminal. And what you should actually offer at that time is palliative care. Let them die peacefully and happy.
Okay, I've been permitted by Chairperson to allow a few more questions for our last speaker, so we can take a break, but then since he needs to leave now. Two more questions. All right, please step forward. One, two.
Okay, my question is, we use a lot of the deodorants, body sprays, and the like. So I want to know, can they actually cause cancer? What type of cancer?
Please, my question goes to the microwave. You know, we use plastic to warm our food, and you mentioned just now that plastic food is not really encouraging. It causes cancer. Please, what can we use instead of using plastic to warm our food?
Thank you.
Sorry, my question is said our meal should be 6 p.m. to 6 a.m. Like, once it's 6 p.m., can we still take fruit or vegetables? Thank you.
So I'll start with the deodorants. So studies have not really shown deodorants to cause cancer. Most of the time, the incidence of skin cancer for us here is not so troublesome. And deodorants have been used for ages. So, but what we're emphasizing is just exercise. The body has pores that flush out most of everything that you put there. The pores they already that push. The pressure is usually outward. Okay. Then let's not be quoted as saying that the plastic container will just cause cancer. We are talking about stored food. Most of the time, they are stored either in some can or some containers. Most of those foods will have preservatives, but they don't also want to lose the economic value of it. So they will put a lot of preservatives. We're not saying that if you just take a cup now and use it to drink water, that's a problem. We're just looking at storage. If I were to take this water and store it for 1 year, it's no longer as hygienic as water that you just got of recent. Microwaves have not been shown to be carcinogenic so far, with the knowledge we have now. But like I said, nature, nurture, not sure. So it's one of those areas where there are still controversies, but it has not been shown that in some group of people who use microwave, they're seeing more incidence of cancer. They infer those things. So if you go to places where they use microwaves, or you're seeing your patient and you use microwave, and you notice that there's a trend, you can suspect that, but that's not the case so far. I hope I've answered.
The very last question.
Okay, whether we can take fruits after 6 p.m. So, like I said, you can hardly go wrong with fruits and vegetables. Hardly. I think, but the problem is most people will try to eat some other food with it. So, vegetable fruit.
One more question.
Thank you very much, Dr. Super, for your presentation. I want to ask one question. You made reference to the kind of maybe the point of eating it totally. That is red meat. And also, second question is you made mention of use stress. Can you elaborate on?
So, we would always say that fish is better than meat. We are not saying don't eat meat totally. There was a time they declared meat as a carcinogen. That's also controversial too. Meat all their life, they never had cancer. But you also have to look at their lifestyle in the village. They will work the farm and come back. We here now, even the exercise that we're talking about, ever do it. So, and then if also you have things like cholesterol, it's more of that cholesterol than fish, as opposed to fish. So we are not saying that when you eat meat, you get cancer. I eat meat, but people who eat plenty meat, eat fat. You know the meat comes with fat. Sometimes we will say eat chicken, remove the skin. That's the fat we want. Eat egg, eat the yolk. Difficult. Exercise burns most of those things. Make sure you vent out. The second one was on. Okay, so I try to differentiate between stress and some people will say life should be stress free. If you have no stress all time, the cortisol hormone in your body won't be secreted, and it's an important hormone as well. So a little of stress is good. If you have people working even in factory, and you don't pressurize, they would not be productive. Even the human body, that you just wake up and food is ready for you, you don't do any exercise, nothing stressing you, nothing keeping you. It's a boring life. That's why you can't take your mom from the village and bring to the city. You want to go back. They feel no stress, nothing. But to a certain level too, it's a graph. It rises like this productivity. There's a level you will reach where if you add more stress, it becomes distress. But this early stress is called stress. It's okay to give that amount of pressure. Even in training as resident doctors, we are stressed. We try to keep it at stress. When it gets to distress, sometimes we may need to see the psychiatrist, we may need to go for counseling and all that. So that differentiation is very okay. So even as a boss, you can give your staff some stress. Make sure they work well, yourself as well. But don't live a distressful life. And for everybody, there's a cut of somewhere where you find that balance.
Thank you so much, Dr. Sike. I think the volume of questions you have, evidence that leaders did great putting this together. Please, my own permission, sir. When we wake up at 4:30 for school runs, to and fro, to and fro, does that equate to exercise, please? Please, I hope you know.
That is, it's actually a stress. It's a stress. But so long as you have not got to distress, we can call it exercise. But when you go out to exercise, like your mind is on exercise, it's different. It's not a stressful, like running around the office, standing to walk. It's better than sitting in one place, but it's not really exercise. There's a purpose for exercise.
I was hoping you allow me to come out and exercise. Thank you so very much, Dr. Sike. We've had a great time listening to you. So thank you, Dr. John, for your patience. I now have the privilege to read the citation of Dr. Edebekong John. Please let's give him a warm welcome. Please stand here and say that. Thank you. This is Dr. Edebekong John. He is a graduate of he is a graduate of, I think a doctor wrote this. Medicine, okay. He is a graduate of medicine and surgery, University of Calabar. Dr. Edeme Compton has more than 10 years of experience of obstetrics and gynecology with special interest in IVF and endoscopic surgery. He is a senior registrar with the OBS and Gynae department. Dr. John is a member of West African College of Surgeons, also an associate fellow of National Postgraduate College of Nigeria. Ladies and gentlemen, here is Dr. John.
Standing on the existing protocol, I've just been told that I have only 15 minutes. I'm supposed to present detecting menopause, fibroid, and cervical cancer. Without much ado, let's dive into the meat of the matter. So, usually fibroid doesn't happen in the neck, it only happens in the neck. Okay, it is a benign growth. There are two types of growth, benign and cancerous. So in this very case, it is benign. Benign in the sense that it will take time before it evolves into cancer. And most cases, it's seen men of reproductive age from 25 and above. But in rare cases, you can also see it in 20 years of age. So from the slide, there is a picture of, yes, this is how a big fibroid look like. Actually, this picture on Monday when I was operating on a particular patient. So this is how she came. This is how it came. So we all thought, the church people, the villagers, our friends, all thought she's pregnant. And she believed she was pregnant. And it took intervention of patients for us to be able to explain to her that this is not pregnancy. There is no baby inside. She argued, she left the first time, came back, that the man of God she met told her that she's pregnant. And these are the reports. So some cases, you need to blame them. And to be very sincere, this woman was a master holder, educated to that point. So, all right. So what causes fibroid? Nature abhors vacuum. If there is nobody in this room, then definitely you're going to see mosquito, rat, or right? So if a woman of reproductive age is not pregnant or has not been pregnant, has never been pregnant, what do you expect to happen? There will be a growth because the environment is mostly muscular. That environment is made for one purpose. The purpose is carrying a baby. So if a woman has not been pregnant before, the growth, the muscles will start changing to fibroid. So there are risk factors. The first one is a woman who has never been pregnant. Then cases of a woman who is on a big side, okay, the woman who is on big side has a lot of estrogen, the hormone that encourages fibroid. And there are some cases like medical cases like polycystic ovarian syndrome. I don't want to get into that. That was mentioned. And unfortunately for us, blacks, is seen in mostly black women. Now, there's a hypothesis that because black women are always beautiful, you understand what I mean? Don't use the word fat. It's not nice. But black men are always very beautiful. They tend to accumulate that level of fat, and the fat converts to estrogen. That alone is enough to lead to fibroid. So if also you eat high fat diet, all right, you eat high fat diet, don't lose sight that you have a sedentary lifestyle, you will also be converted to estrogen, major because of developed fibroid. And so in case of family history, if your mother has fibroid, 50% is likely that you go to have fibroid, except you take precautionary measures, get pregnant when you should get pregnant, eat a good diet, and also lifestyle modification exercise. And women who have infertility issues, in that they are unable to get pregnant. So also some factors that can reduce this risk. A woman who has been given from 5 above, the risk also reduces. And a woman who is in menopause, all right, who has seen her menses and stopped seeing her menses, the risk reduces. That doesn't mean she's not going to have. The risk reduces. And also, if a woman has been on family planning, like combined wrap and pills, the tablets, for up to 2 years in risk. And these days that are Gen Z generation, women who do smoke, shisha, tobacco, and the rest, there are risks of fibroid. So normally you see fibroid in different places. You can see it here. This is the vagina. You can see it here on the cervix. This is the part of the womb. You can see it here. You can even see it in the ovary. So it can be located at any place. Okay, depending on the size, it can also be seen close to the kidney. So how will you feel? How do you know that this person is likely to have fibroid? Most cases, more than 25% of the cases, the person doesn't have any signs and symptoms. The normal person walk around, does not, because the fibroid are small, the menses are normal, and it's only when you go for routine examinations that is when the doctor pick that see you have fibroid and it's growing. These are it is. And the most commonest complaint we normally feel, we experience more than 90% in the clinic is the woman will come in that her menses is heavier than normal. Okay, I used to see 3 days, now it is days. I used to use 3 pads, now it's more. So when the menses come, I'm feeling very deep with cloth. And also, if when you're in a menses, you some spots in come, and maybe the menses can also come with pains. And when she's about to experience pain, depending on the locations, the fibroid can also causes some form of infertility. A woman will not conceive. If it's on the upper part of the womb, the woman will likely not be able to conceive. Even if she'll have repeated miscarriages. Okay. And if it's very big, like this one, there is they call it ureter, the pipe that carries urine to the bladder. If it's so big and compressed, the urine go down to the kidney, causes urinary infection. It can cause kidney failure. That kidney can better be damaged if it's not salvaged. If it's on the back, it can cause back pain, serious chronic pain. You will take all the pain relief this one, you drink all the alcohol you want. So there are it can also, if it is on the top and the patient bleeds severely, if measures are not being done, the woman will be to death. Okay. So like in some cases can lead to serious infections. I'm not here to scare you, just get the information that it is treatable, right? So option of management, there are so many options, depending on the age of the woman, on the severity, and also what she wants, and if it's also emergency. So it can be on our observations. If the fibroid is small, then it doesn't cause any pain, it doesn't cause any symptoms, go about normally. It's okay, it's pregnant. Why do you want to do anything? Let it be there. God will take care of it. And if it's less than, if it's not visible enough, you can't operate it, just let it be there. And also, if in some cases that you know the fibroid is growing, you can actually follow up this woman. So you follow it up and see if you continue to grow. If you continue to grow, you do something about it. So another way is doing fibroid operation myectomy. Myectomy is done in so many cases. It's very safe. Just that being human, we all are afraid to go on that line, but it's very safe. So if a woman is like that big one, we have to operate it. And we notice that if she has been having recurrent miscarriage, notice that it affects her fertility. You have to be going and opening out. Moving out, the patient is likely to have conceived. And in some cases, after 2 years, if the woman doesn't take in getting pregnant, it's likely to reoccur. It's not a must to reoccur, but it's likely to reoccur. So in all, at the top of conclusion in this fibroid, I'm not saying you should rush and get pregnant, but it actually helps. And if you notice that your stomach is getting bigger, then you have to do something about it. Any question on this while preparing for sequence?
Thank you for the first presentation. I just want to ask if fibroid can be cancerous.
I'm actually a survivor of fibroid. I want to ask a question. Can traditional medicine cure fibroid? Thank you.
Okay, my question is there any relationship between cyst and fibroid, or can one lead to another?
My question is on there's a friend who told me that she was diagnosed of fibroid, but the doctor is telling her not to worry since she's approaching menopause, that the fibroids won't be fed anymore with blood and they will dry up. I don't know whether that is okay. Can a fibroid that's not treated already for a long time lead to cancer?
Definitely. I want to know, my question is on fibroid recurrence, especially in family where fibroid is hereditary. What are the preventive measures, or what are food choices that you know people who have undergone fibroid operation should try to prevent eating so as not to have a higher chance of recurrence? Thank you.
Thank you so much. I want to find out from you what are the chances of one having a fibroid, maybe being operated? What are the chances of that getting maybe having to procreate or getting pregnant? What are the chances? I want to know.
Okay. A woman that stopped giving birth and has not reached the age of menopause or has not reached menopause and doesn't want to give birth again. And you said when during the age of reproductive that there's no baby in the womb, that's when the fibroid gets chance to grow. So what should that woman do?
My question is, first of all, I want to ask, is there fibroid in every female? And again, does STC supplements shrink the growth of fibroid? Thank you.
Hello. Thank you for all the questions. Let me correct some misconception. Traditional medical cure, traditional medicine, from years of practice, they have not been seen or proven to have effects on fibroid. It cannot cure fibroid. Why it cannot cure fibroid is because it's growth. One, it will only give you psychological booster, it make you feel it does something. Meanwhile, the traditional medicine you are taking is affecting your kidney, is chopping, is killing it gradually. So if this growth is removed, it will continue to grow. The SCC supplement, I don't do deals with SCC supplement, so I cannot authoritatively say what it does. Can fibroid change to cancer? Yes and no. Yes, in the sense that if I see a fibroid in a woman who is menopausal, who has reached her menopause, 45 years, 50 years, and she comes down with fibroid, the first suspicion I will have is that is not fibroid, that is cancer of the womb. So it's, the best option is the counselor take out the whole, because at that stage she's not in need of that woman again to get a child, right? So take out all the send it for stuff. So in some cases, it can actually transform. We call it transformations. It can actually transform after menopause. From 5 years, say a fibroid, it can transform, but it's unlikely. It's about 0.5%. It's unlikely. So you may not know which one. So advise them take it out. Cysts and fibroids, cysts has nothing to do with fibroids. Cysts is mostly seen on the ovary. Then fibroid is in within or outside the womb. So that's quite different. So someone asked about the woman is near menopause. I don't say don't worry, but yes. So if the woman has finished her family size, have all the children she wants to, and she presents to the hospital with fibroid, we need to take assessment. One, how big is the fibroid? Where is it located? Is it located to a place that it doesn't cause any harm? Does it feel okay? And quality of life, does she feel okay with it? Does it change her six pack or flat tummy? If all these are normal, so there's no point rushing for the surgery. Tell her, okay, as menopause come, we will follow you up. It's likely it's going to shrink because the estrogen, the main hormone estrogen, that the fiber feed on to grow, will soon be starved. And in some cases, if you do medical treatment, give you drugs that will push you very fast to menopause, so that fiber could shrink. Prevention. The only preventive, there's no established preventive measures for fibroid, but with exercise, it can also help to alleviate some of the symptoms, pain, the bleeding, and the rest. And also, if you program weight loss, big side, it can also help. Then someone said, can a woman deliver or get pregnant after the surgery? Yes, about 40%, or even more, very more. The further surgery actually helps for you to get pregnant. It depends on who does it, because it's a surgery. They are going inside someone's body into that muscle. So you need to be extra careful not to close it to you or not to distort. Yes, if it's like this one, just use cystoscopy, just remove it. Tomorrow the man goes up. There are ones that feel up this pain that they really supposed to stay. So it needs extensive major surgery to do it, which is okay. So if a woman has finished family size delivery, then if she has fibroid, it will be done based on cost. If the stomach is too big and she's not comfortable to be a kidney, then she can go in for the surgery, or she allow it to be dead. But likely she's gonna have pain, extra menstrual pain and the don't. So let's go to the second topic about cervical cancer. So, who can tell me what is there on the screen? Okay. It's not only couple that are happy couple that are supportive, right? How about this one? Not happy, that supportive, at least the man follows the woman to love. Okay. So today we're going to talk about another one, the cervical cancer preventable. So this picture, everything we want to talk about will be on here. This is where the service is. The man, they call the man of the womb. So this is how a pregnant woman is. From year to year is the cervix. I'm sorry, I don't want to tell you people to doctors and nurses. So this is where the problem is, the cervix. Cancer is one of the commonest malignancy. Cervical cancer is one of the commonest cancer in the world. And in Nigeria, it's one of second to breast cancer. Okay. In worldwide, about 500 new cases are diagnosed. 500,000 new cases are diagnosed yearly. And out of these 500,000, more than half of them died. And you can imagine what is happening in Nigeria. Sorry, I just lost some money. I lost some money. Sorry, I can't say. I couldn't help this late presentation. So what happens is this. That place I show you, as the woman grows, there is a change. This side supposed not to have, this is where the cancer comes in. If there is a change here, and it's not detected on time, it will transform into cancer. The primary cause of cancer is human papilloma virus, HPV virus. That is very common. Divided into the high risk one, and there's what the low risk. Okay. Funny enough, this human papilloma virus is sexually transmitted. And in our lifetime, almost everybody, if you are not vaccinated, exposes to this virus. People who have good immunity are able to handle this virus and deal with it. It's only some few cases that it takes like 15, 10, 15 years to progress to cervical cancer. Like people who have low immunity in the HIV patient, the gay and the lesbians and the rest. So what are the risk factors for this? One, being sexually transmitted infection. Early age at first intercourse is one of the risks we see. On Tuesday, they brought a young girl. How old was it? Or how old was she? 12 years. What happened? She was staying with the sister's husband and she was raped. She came in bleeding seriously. She couldn't even tell anything. She was scared, shaking. I had to threaten her because I wanted to know what was the problem. So she fell at the bathroom and saw her on the private part, which was totally lying. It was what the man told her to say. So I told her, oh, if you're not going to tell me the truth, I will abandon you here and you die. She will go to death. So I sent everybody. She told me this man has been molesting her for a longer time. Now, the question as the doctor said, what can you do? Reasonably, nothing. Call the police, yes. The question is, where would this girl go to? She will go back to the same society and she will be ostracized. So the cycle of violence is a sad story. It can be depressing. There we are in with Buhari to. So another risk factor is multiple sexual partners. If in the case of a woman have one boyfriend, the one boyfriend is not faithful, he's likely to have another girl. So it's still cool, keep on changing. And male partner will want pure sexual partners. And the issue of this HPV, the high risk one. And people have oral contraceptive, the particular one, we call it estrogen only pills. Also has that are risks of it. And cigarette smokers, because of nicotine, it also affect that service and it changes with time. Family history is very common because some of the cancers are genetic, not and recently we noticed that it has been in what established, no, we just recently noticed that male who are not circumcised, that in male they can have cancer caused by this HPV. Now, let me make it clear. Men can have this HPV virus, which causes 95% of this virus. What HPV does in men is it causes genital warts, which will later evolve. And we go and sleep with another lady who doesn't unprotected and transfer to them. So how will you know signs and symptoms? How will you know if a person is at risk, if not having severe cancer? The person will begin to have and if after the message you still have some spotting coming out and like foul vaginal discharge is not good, and even after meeting with the spouse, after the action, you still see blood, you begin to query, you need to worry. Don't just cross over it. Nothing's happening. And if a woman is, in most cases, after menopause, you see a woman number one sign is cancer of the cervix. And if they're always having pains and pelvic pains or fistula, another connection between the vaginal, So is cancer of the cervix preventable? Cancer is yes, 100% yes. It can be prevented. It can be cured 100% if detected on time. That is why prevention is better than cure. So the earlier you notice, the earlier you get that on time. I won't even bother about things. It will help everybody, help you. And imagine if you achieve so much at the age of 50, 60, you still now start having cancer. It's a drama, it's a nightmare. You don't just pray for it. So prevention to be primary, secondary, and tertiary. Prevention is made basically to avoid having this disease. You don't even want to have it. Assuming you have it, it's called prevention. Assuming you have it, early detection comes in. I prefer primary prevention. But people would have it. Because that maybe try and treat it, try and get diagnosed on time. Tertiary prevention is basically treatment, management. We are already having cancer. What can we do to save and preserve your life? So education matters a lot in prevention. Creating awareness, avoiding risk behaviors, social media, mass media, talk shows about talking about this cancer. Also, abstinence is very important. Then delay the first time you have sex in female is very good. And also, any marriage should be discouraged by all means. Multiple sexual partners not advocated. High parity Having more than 5 children, no. The more you have, the higher risk you are get yourself involved. Using condom, which is very good, it prevents you having sexual transmitted infection, also prevents you having getting pregnant. Cigarette smoking, avoid it. Early living, food and exercise. Early living says that mostly vegetables, the green leafy vegetables, even the red ones, are very also good. Exercise, exercise. You keep on having on exercise. You cannot you cannot just play out. Sorry. And HPV vaccine, there was a time recently they brought HPV vaccine for young girls, and people were canvassing and guessing. We will still come to that, a lot of things. So the vaccines, there are 3 vaccines that make. So you encourage your daughters, and this vaccine ideally can be taken from 11 to 12 years. But Nigeria population, we started from 9 to 14 years. You get it 2 doses. It helps. If you get a vaccine, more than 99% sure it prevents you from HPV infection. If you miss at these 12 years, you can also get it at between 13 to 26 years if you not had the vaccine before. In males, you can also have it. Okay, it's not only female, male is the most you have it because HPV affects breast cancer and can also lead to some cases of prostate issues. WHO advocates that the target primarily between 9 to 14 years of age, the female, for them to have this vaccine. Currently, they have been going on free vaccine, free, and it's very expensive. When my wife had her own, a vial was 75,000 naira. That was 5 years ago. So imagine how much you can pay for it, and the federal government are giving free of charge. So just a small shot like teaching, and you go with minor side effect, pains, and irritation and fever, not too much. So if the primary effect doesn't work, you go to second effect. How can you detect it on time? So we have a lot of modalities. Past men, every woman here know about past men, right? So past men, you start some countries start from 21 years, some start from 25 years. When we pick that 21 and 5 years, most of the vaccine, the body has a way of handling it, and it doesn't mutate to survive cancer. From 25 years, from that, based on protocol in national hospital, from 25 years we do it 3 years. Every day 3 years, you do it, come to hospital, do pap smear. If it's okay, you go home. After 3 years, you come here, come back, you take the test again. Then if it is abnormal, if it's not good, we send you to colposcopy, a small machine to look at the cervix and take a biopsy and send it. Yes, this colposcopy. We have about 5 of these national schools. You take the machine, look at it, take a small thing, yes. And if it's abnormal, we treat it there because it will start like a rash on that cervix. When we see this is abnormal, we just use just like a stick, we burn that place off, and you are fine, 100% safe and cured at that time. We go, then we come back for your routine. Next one. So these are how we do it. The doctor sit down, talk, look at the screen. You take the test. Then this is a past man. You just use the brush here, and take it to the lab for the test. So this is a normal service. Here it is, no problem. So as you keep delaying, if you are not doing anything, it will spread, will spread, will spread, will spread. When it spread, it does not only stop there, extend to the um to the womb, to the ovary, to the intestine, to the urinary tract, to their chest, everywhere, to the backbone. And when it comes to that, advanced cases. In advanced cases, we only do palliative. Palliative means just take out the pain. If it's too, if you cannot eat, you pass it to you. If you cannot pass urine, you pass it to you. Just prolonging when you go to meet our father. So it's just palliative. So let's go look about misconception about HPV vaccine. Now, I want yes or no. Cancer reserve screening method if the person are adequate preventive and no need for the vaccine. True or false? HPV vaccine is false. Because screening alone the person is not enough. Okay. HPV vaccine could cause infertility and is meant to regulate our population. So it's false. You have not been fertility. So take the HPV vaccine. HPV vaccine for female 9 to 14 years could promote sexual promiscuity and encourage risky sexual behavior. HPV vaccine causes very severe side effects and complications during disease. It doesn't. Abstinence from sex is what is needed to solve the problem of cervical cancer. HPV vaccine was brought to arm the population following their refusal to massively take the COVID vaccine. Okay. It's false. You have something to do it. The vaccine also causes cancer. False. It doesn't cause cancer. There could be another side effect that appeared that we should not know. No, it's false. There's no because this HPV vaccine, before a vaccine is brought to be vaccinated, which was emergency, you go through a lot of trial, minimum 10 years. You go through different stages from rabbit to monkey to human, different woman who's pregnant, different stages before you can be licensed to be vaccine. Exceptions because the HPV vaccine is too new and not well tested enough to know. This is false too. So we've said a lot about cervical cancer. It is a preventable disease. The main objective is prevention, better than cure. And HPV virus, which is the major cause, can also be seen in men. Can be also be seen in. You know, the thing about hospital disease, you rarely see a man come. If you see a man come to hospital, that is serious. You have to stand up. So you have to buy the wine. Yes. 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 Unfortunately, these men are the one transmitting it. So let's run it. So that is it for tonight cancer. Should I take the last presentation for question or? So the last one is what is menopause? Okay. It is a natural cycle in man's life. Every woman will definitely go through menopause. I pray because it's a season of blessing, right? So if woman are not seen a message for 12 years, 12 months, repeated for 12 months, we tend to say that the woman is into menopause. But there are some rare cases that you need to evaluate to find is it really menopause or not, so which we will see. So one of them is to do hormonal profile. you check. Some of us will go down, some will go up, some will be normal. So, the egg, everything, this is about egg, the ovary. The ovary happens. That estrogen, the one that is causing fibroid, is also the one, if it is absent, if it is too much causing fibroid, it is absent menopause, right? So if this estrogen and some other ones, those stimulating hormone, the LH, all of them, if the estrogen is near absent or absent, that woman is likely to menopause, mean that the egg is not functioning well. So what are the risk factors? If a woman is on the big side, African woman, number one, so it's likely to go into menopause faster. Smoking, tobacco, another one. And if a woman has a sedentary lifestyle, always sitting down one place, exercise, so it's likely to go into menopause faster. Those social community factors, poor people, and people don't need to go to school. I don't know how true it is, but everything is all about poor people. So African ethnicities, I've said this, and people who have issue of depression and anxiety. So how do you know this woman is actually surviving menopause? One, you start seeing the short-term complications, the hot flushes, called the night sweat. The woman is having lost concentration, or become very anxious, bitter, talking, getting irritable, and then and dry skin because the estrogen is down, skin is no more like young ladies or dry, flaky, hair loss, and the rest. Long-term complication, you start having bone pain because the estrogen is reducing, having hypertension, heart disease, and also having dementia, forgetting something, all these things. So, what is this all flushes? Some call it internal heat. I mean, so mostly seen in menopausal women who are close to menopause or who are at their menopause. So normally, it means that the heat regulating system in the egg is reduced. Small heat will affect them faster because estrogen has hormones has reduced. So they get very hot always and frequently. After being hot, they get very cold and chilly, shivering more frequently too. So most of these all flushes, we start seeing a woman for 40 years, 45 years, in some cases 50, but the average menopausal age in Nigeria between 49 and 50. Start seeing her sweating from head, neck, chest, breathing heavily, sweating, panting. Most of them you see them like that. And can have this symptom so many times in a day. And most of the symptoms can always see at night. Because of this, the hot flushes, internal heat. They can't sleep well at night. They will find it difficult to sleep. They find they wake up more frequently at night. When they wake up frequently at night, they find it difficult to go back. As most of them cases, they have nightmares. So don't just say it is. Don't just say it is menopause because some other things, some other disease can mimic like this. Somebody has leukemia, thyroid disease, someone who is stressed, somebody having some form of chronic infection can mimic it. It can also, in a woman's part, you find it difficult because of this menopausal stage, find it difficult to enjoy our partner because you always be dry, having itching, having urinary tract infections, having discharges. And also, it also affects bone because the bone becomes very soft and can easily break. So you need to be very careful. So how can you treat this one? How can you manage it? You can use medications, hormonal or non-hormonal. I can also use conventional ones. We call it alternatives. We try to tell the one to try and relax. Okay, do yoga or meditation. Eat healthy diet is very important. Get regular exercise. Okay, avoid all flashes. Avoid time for our mamas. You know what I'm saying? So avoid wearing title. It helps to keep in check. So the most of the drugs we give, mostly are hormonal. So you must look at you know that you fit very category before you give her the drug to help with this menopause. So menopausal symptom is not really that bad. It can be treated perfectly well. So you just want to identify and also notify your doctor. Thank you. Any question?
Thank you very much, sir. Our question will just be very brief, just like 2 minutes. Please go straight to the point.
Thank you so much, Dr. Edema. I want to ask a question in terms of this menopause. Does family planning happen to, fast track menopausal period? That's one. And how do I put it now? What are the solutions to that when you are in menopause? Probably those signs you just mentioned now. How is one about it to be okay? Manage it.
Thank you very much, Dr. Mine is on menopause. I was told that palpitation is a symptom of menopause. So I want to know what can be done to manage it in a situation where one is still having it after it is, supposed to have been, that's the menopause is supposed to have been. Thank you.
Doctor, you talked about getting vaccine that from in Nigeria is from 9 years and upward. But at what age is it not givable?
My question is on menopause. I want to find out, is there any drug that can lead to any menopause? That is one. Then the second one is this symptom of menopause you mentioned, like the canal heat. After I heard that, after a while it will stop. But what if it continues? Is there any solution? Yes, Dr. Stone, early menopause. I have a friend that had menopause at age 39. Is that in any way related to health problem?
Okay, over to you, sir.
All right, thank you so much for your for this beautiful contribution. Let me start from the red. At menopause at 39, we call it premature menopause. Right? It's supposed to be for at least 39. But it's okay. 45 is not bad. Averagely in Nigeria, menopause average menopause take like 100 people. Average of them is supposed to have plus 49 to 50, 49 50. But 45 to is okay if the person is damaged like person in a menopause. If anyone who is 39 is menopause, we call it premature menopause. It could be due to so many things. One, family traits. Our parents had similar cases of issues. Or if she was exposed to radiation, chemotherapy, some drugs, some creams people are running on can lead to that because it destroys the ovaries very fast. Yes. And if the person has surgery and ovary was removed, it can lead to menopause. The whole pathology, the whole thing is around the ovary. Family planning, yes, it can cause early menopause depending on the time. Depending on the time. If the one they call IUCD, no, it doesn't, because that one is just if there is like some implant they put under the hand, that's some ties. I don't want to mention for somebody go and buy it. Some of them you can use it to treat fibroid at some time. So we push the person to menopause faster to tell the person. So you can actually got some depending on because there are a lot of family planning, a lot. So it's individual, based on individual, not because Rose is taking one family planning, you also that. It's tailored. You go to your doctor, the doctor asks so many questions, examine your evaluation to know which one for you and give it to you. Palpitation, yes, palpitation is one of the symptoms of menopause. Okay, but you get to understand that it's not only menopause that causes palpitation. A lot of more than 10,000 causes of palpitation. From thyroid disease can cause that, from anxiety, from the drugs, hunger, you're not eating food, okay? From even when a woman is pregnant, it usually has a lot of causes of palpitation. So the role of a doctor is to make sure that you know, as in, you get a value to know what really is the cause of this palpitation and solve it. If the cause of palpitation is because the woman is having high blood pressure, give it medication and it solves it. Okay, but if after evaluating and notice it is caused by this menopause, hormonal replacement therapy also can help. HPV vaccine can be given. HPV vaccine can be given to 6 years. It can be given up to 6 years. In some centers, it can be given. It can be given to 30. What you need to understand about vaccine, the target group, that's what we are targeting. 9 years to 14 years. Other ones, if you come, it will test you first to know if you have HPV virus. If you have HPV virus, you can get a vaccine. All right? Even if you are 40, if you go for the vaccine, you have to test to see if you have HPV virus. Once you have the vaccine, a virus, the vaccine does not take. All right? The target group is between 9 and 14. These are small children we need to protect. Internal heat. No, who was asking about internal heat? Yeah. So, yes, if it continues, that means we need to evaluate, we need to find out what is the cause of this heat. It may not even be menopause, something else. Maybe something else, maybe tumor somewhere, cancer somewhere, maybe malaria. We need to find out. The purpose is that we need to find out what really causes. As a doctor, we are trained to find out what is the cause. We don't just give you tell you do this. No. You need to find out what really caused this before you.
Let's go to come out. Let's go member, let's go member. So now I tell you for us. Okay. We need to explain ourselves. So all let's go member, can you come out for you? So we do that with our resource people. I think this is resource. Madam Princess, where are you? I don't remember about your Princess. Amaka, where are you? The big one.
Of copyright national office. Married with three beautiful children. You're welcome.
Thank you. Thank you. I want to start with the existing protocol already. Thank you.
Hello. Please, visitor, please. Visitor, please.
So the topic we are going to take the topic we are going to take is stress, hypertension, and depression. I know the first already spoke a lot about it, but we're going to say. So I'll start with an overview. Of stress, depression. Talking about stress, depression, and high blood pressure. So there are a few things we have to understand before we go into detail. So talking about health now, because we're looking generally at our health. What is health? It's a state of mental and social well-being. I'm still on this end. A state of physical, mental, and social well-being, not just the absence of disease. So physical well-being on one end, mental well-being on one end, social well-being. And these three are interrelated. That is when you are healthy. So for lifestyle medicine, they need to find out with evidence that there are root causes of illness in the population. So there are root causes of illness you can see here. Lower down, we see like a picture of a tree with the root causes. We can see, I don't know if it's clear enough, we have toxins, poison. So it's just trying to tell us that there are certain lifestyle behaviors that we do in our daily life that give rise to this tree, which is disease and health issues. And 80% of these disease and health issues are diseases of lifestyle. That is bringing us back to the emphasis on the importance of our lifestyle, our daily habits in improving our health. So we can see the root causes because this is just an overview. We'll see each of them as we progress, how they tell. So we can see the root causes, toxins, we can see symptoms, no exercise, we can see stress, we can see poor diet. So we can see the root cause. One of our topics for today, stress, the root is part of the root. We can see one of our topics today. We can see depression is one of our topics today. Is one of the diseases that sprout from the root. We can also see high blood pressure as one of our topics today, which is one of the diseases or health issues that sprout from poor management of these root causes. So in the course of this presentation, we're going to talk about toxins. We'll talk about toxins with substances like smoking and alcohol as root. Firstly, we see the role of poor sleep. We see the role of social connections in terms of the negative thoughts. We see the role of diet. We see the role of stress management as in a bid to reduce this disease. So next slide. So we're talking about lifestyle medicine. These are the pillars. We're going to our topic. This is just a background for us. So these are the pillars of lifestyle medicine that help us to stop 80% of the diseases that we've seen, which includes the topics for today.
So we have the avoid risky substance like smoking and alcohol, whole-based plant diet, that's talking about nutrition, whole-based plant diet, consistent regular sleep. So we have to pay more attention to our sleeping habits, daily physical activity, positive healthy relationships, talk about social connections, and then stress management techniques which will address the group. So while managing stress, proceed to managing stress through this online. So stress is a fact of life. If we learn about eustress when the first talk to us, eustress is positive stress. We need to maintain a certain level of motivation. It's part of our daily activities. So changes in our lives are frequent sources of stress. Getting married, getting a new job, having children, taking care of a home. So it's changes in our lives are sources of stress. And stress is anything that poses a challenge or threat to our well-being. Perceived challenge or threat, anything that does that. Next slide. Stress is the way human beings react, both physically and mentally, to changes. So the way I react to changes determines my stress level, and it depends on my perception of the stress. So the reaction people have to excessive pressures of life, it arises when demands of everyday life exceed coping mechanisms. So it's still telling us here that it depends on how you cope with the stressors that you have that determine your stress level and your reaction. So your coping is very important. So this is feelings of worry, tension, anxiety, anger, or fear. So stress response is a physiological reaction that occurs in response to a perceived harmful event. The word there is perceived because someone else may not perceive that event as a harmful event. So the epidemiology, how frequent is it? According to the Occupational Health and Safety Report and the National Council on Compensation for Insurance, up to 90% of all visits to the primary care physicians are for stress-related complaints. Up to 90% are for stress-related complaints. And it's like physical symptoms, but the root is still the stress. Next slide. Next slide. So that slide has said that emotional stress is a major factor. It's a major predisposing factor. So now we go into the stress response. What happens? What happens when I perceive stress? What may be stressful for me may not be stressful for someone else. Like having a child may be a stressful event for me, but someone else may be with enthusiasm. So the person copes better. So because the person has coped, the person will not perceive it as stress, and the reactions that follow, and the body reactions will not interpret it as stress and give the response. So we are going to stress response. Stress response. So stress, what does stress do? Perceived stress, like we said, activation of the cerebral cortex, hypothalamus, focus on activation of some areas in the brain and the nervous system, and there's release of some hormones, cortisol and adrenaline, and it's the effects of these hormones that give us the stress symptoms that we have. So cortisol is going to cause increased blood sugar. So someone that is already pre-diabetic, someone that is already has a genetic predisposition, will have that sudden increase in blood sugar, and then it may push the person to over diabetes. Those are some of the things that happen. So there's the hormones to cortisol and adrenaline, the heart rate. Before the person is having an awareness of heart rate, and then the blood pressure can also transiently increase. So sometimes you come to the hospital, you have elevated blood pressure, but you may not really be hypertensive. It may be your response to stress. So that's why sometimes you are in the hospital, you have elevated blood pressure, medications immediately. Repeat it and take care of some other conditions. Stress reaction. So depending on how you react to the stress, that's what we call stress reaction. So it could either lead to breakdown, to have maladaptation. If you perceive it as a stress and you are not coping, so you maladapt and you cause it a breakdown, or you could cope with it, which is the second bullet, you could cope with it and it brings you to an equilibrium. So even though the stressor was there, those hormones were produced, but the body is able to come to an equilibrium because you cope better. So and then with that stress response, there's also something called relaxation response. So even after a stress response has been done, when the stressful circumstance is no longer seen as a danger, so those processes reverse, the heart rate, respiration rate becomes normal again. So this is what happens. So we look at it, we'll see more about it as we proceed. So the symptoms of stress, we're trying to use this pathway to know how we get the symptoms. We said increased heart rate, increased blood pressure. So with increased heart rate, person starts having awareness of heartbeat. So the person may start having fatigue, person have poor concentration, so that the physical symptoms. Then the mental symptoms, panic attack. Panic attack is like a sudden feeling like you have a heart attack. It looks like a heart attack, but it's not real. Sudden onset of like you cannot breathe well, you feel like you have a feeling that you're going to die, like impending death. So they call that panic attack. And the difference between this and heart attack is that within 10 minutes, it's episodic, within 10 minutes it peaks and then it goes away. So the person has somehow developed a mental problem that is transient that will be treated when the stress is resolved. So emotional symptoms, irritability, impatience, anger, then behavioral, some changes in behavior, like people when they are stressed, they don't really eat well, they don't eat junk food, take anything they like, some going to alcohol, some going to smoking. So that's impaired, so that's behavioral reaction, symptoms of stress. So we see stress-related illness, so I'm trying to be fast. Stress-related illnesses, we talk about it, sudden increase the surge in blood sugar because of that cortisol. So it could lead someone into overt diabetes, ulcers also. Some of the ulcers we have, they are stress-induced stress ulcers. So cardiovascular disease, we talk about elevated blood pressure. Those hormones, adrenaline, noradrenaline, they can cause elevation in blood pressure leading to hypertension. Hypertension could lead to stroke. So that's the cardiovascular disease we're talking about. Then depression. So people, when they are stressed, it leads to depression because of the pressure. Then immune system disorders. There's reduced immunity, stress, the basket of events that happen in stress makes someone's immunity impaired. So stress assessment, there's a way we can also assess ourselves to know our stress levels. We've already heard about stress, so we have a score, perceived stress scale assessment. That's why it's perceived. So it's going to score individuals, and then is scored between 0 to 40, 0 to 10 is low stress, 14 to 26 moderate, and then 27 to 40 high perceived stress. So the higher the stress level, the more those reactions, and that's what we don't want. That high perceived stress level, it brings out those reactions and those stress-related illnesses. So that one is called, I think we can do it for ourselves, perceived stress scale. Maybe later today we can do it. What is sorry? So you can Google it, perceived stress scale to come out, to ask you a series of questions. And it will score it. Yes, perceived stress scale. So you see the questions there, so you can tick, and then you get your answers, then you see the ranges are posted there. So, but how do we prevent prevention and treatment? Reduce exposure to the stressor. So we know something is causing this stress. So it means I have to deal with this stressor, and we can have these 4 A's at the back of our mind. First of all is to identify what is stressing me. What exactly is my source of stress? There are different sources of stress. It could be internal or external. I think I skipped that slide. It could be internal stress or external stress. There are many sources. The slide is there. So internal stress comes from your inherent, your personality. Maybe I'm a melancholic, you're a workaholic. So that causes you internal stress. You have your own life choices that you make. That stress is from you and your perfections. So we also have external stress. External stress can be from job demands, home demands, demands of day-to-day life. These are external stresses. So now the first thing is to identify that stressor and then apply these 4 A's to the stressor. If it's something you can avoid, is it something I can avoid? For example, if there's a particular news that gives you stress, can I shut down on this, or if I take the news of it, just get the higher, can I shut down on it to take care of the stress? Another A is alter the stressful situation. Is there any way I can change? Is there something I can change? You ask that question, then adapt to the stressor. Is there any other way I can look at this stress? You know, sometimes some stress, it depends on our outlook, the way we look at it. So is there any other way I can view this kind of stress? Also help you to deal with it. Accept the stress you can't change, like death of a loved one. Death of a loved one, you can't change it. A stage of grief, acceptance. So part of stress management for that is to accept the stress you can't change. So that will help you to manage the stress. So also practicing techniques that alleviate stress. We talked about those pillars. So some of the pillars are coming up now. So techniques that alleviate stress, nutrition. We talked about reducing immunity when you are stressed. So taking note of good nutrition like those vitamins, A, B, C, vitamin C especially, they help you to work on your immune system to reduce the stress. Then exercise. Exercise also it produces good hormones, endorphins, that have give yourself a sense of well-being to feel better. We'll talk more about exercise more detail. Then sleep also. Sleep is very important. It improves your mood, improves your concentration. So there's something called sleep hygiene. Sleep hygiene. How do I make my better? There's a sleep scoring system. Pittsburgh index. Pittsburgh sleep index. So if you score yourself and you find out the quality of your sleep is not okay because the sleep is about the quality of the sleep and you feel rested when you sleep. So there's something called sleep hygiene. Sleep hygiene, a series of steps that I need to take to help me to sleep better. So I'll give you a few tips on sleep hygiene that sleep and wake up every day. Having a regular time that you sleep and wake up every day, then having a routine. Having a routine makes maintaining the room dark, a dark, quiet environment to make you easily sleep, reducing alcohol. So there's social connections, having positive relationships that encourage you, that give you positive thoughts, because you saw in the root, negative thoughts are a root cause of those illnesses. So positive connections that help you to cope better and keep some level of support. So also look at time management and organization. Sometimes when you are just on time, you really get stressed. If something was urgent, was important, you didn't do it on time, procrastinated, and it became urgent. So that urgent increases these hormones and this response. So time management, prioritizing things that we want to do. So spending time in nature is about taking walks and mind-body techniques. Mind-body techniques. There's evidence to show that the mind, what happens in the mind is related to what happens in the body. Mind-body techniques. So this breathing exercise, I know the first speaker already talked about it. Taking deep breaths and then feeling yourself releasing the breath. Those deep breaths, those exercise, then taking a walk, then increasing your water intake. About 3 liters a day is the recommended water intake. So when we look 3 liters a day, this female body, the next size is 1.5 liters. So at least 3 liters is what we have to use. So I'm just trying to be fast so I don't bore. So I have 3, we still have hypertension and pressure. So just trying to be very fast, I don't not too fast. So the next topic, hypertension, is very common. Is that hello, madam. Silence. Can join the lecture, please. Silence, please. Thank you so much. So hypertension is very common. This is the outline. Next slide. So it's a major risk factor for cardiovascular or heart attack. That's a risk factor. So it's when the blood pressure is above or equal to 140/90 on 2 or more occasions. 2 or more occasions. So that transient increase that happens during stress. So when you do it again, it may not be up to 140/90. So hypertension is different from the stress-induced elevation in blood pressure. Hypertension is actually when you have a blood pressure above or equal to 140/90 or 2 or more occasions, but there's still a grade. It has different grades and severity with a pre-hypertension. I want to put the emphasis on that pre-hypertension. We said 140/90 and above. And normal blood pressure is 120/80, below less than 120/80. So we see there's a margin between that 120 and 140 above, and then between 80 and 90, that is pre-hypertension. So there's something that happens in that state. The person is at risk of moving into overt hypertension if things are not done, which is the lifestyle measures that we talk about as we proceed. So it's common to, so 46% of adults are not aware that they are hypertensive, and it's a major cause of premature death worldwide. So we have some risk factors. Before we say someone is hypertensive, there are different classes of hypertension. There are different types. There's the primary one and there's the secondary one.
The primary one is more common, 90 to 95% of cases of hypertension. The primary one, and the secondary one. That primary one is the one that has the family history of hypertension because any of the risk factors can predispose the person to the primary one. Secondary one is when you have other diseases in the heart, in the blood vessel, in the kidney that now make you to have hypertension. So the risk factors for hypertension: unhealthy diet, a diet that is void of fruits and vegetables. What we really do is to take more of fruits and vegetables. Physical inactivity. So what about physical inactivity? What we encourage is exercise. There are different types of exercise: moderate, intensity, high intensity. So what we say is start with brisk walking. Brisk walking. So what is recommended is 30 minutes 5 times a week of brisk walking will help to reduce this risk factor. But if you're already into athletics and you do high intensity exercise, things like jogging, running, playing football, you can do half the time in a week. So consumption of alcohol is a risk factor for hypertension. So the recommendation is moderate amounts of alcohol, moderate amounts. So we're going to to the next slide. More than 65 years old disease is part of the secondary causes of hypertension, like kidney disease. So most people don't get anything when they are hypertensive. That's why some people just sudden death, sudden coma. Just so if you don't have any symptoms, but the BP may rapidly rise and cause a stroke. And a very high blood pressure cause some of the symptoms that the person can have when it's very high: severe headache, chest pain, dizziness, boozing in the ear, nosebleeds is very common also. Very high pressure. We saw it was like suddenly started having nosebleeds. We checked the BP and it could be high. So that's a common presentation. Symptoms of complications. So hypertension itself has complications on the heart, on the kidney, on the brain. That is stroke. That is why when we see you in the clinic, we have to detect complications. If present. So the investigations that are done, like I said, are to detect the causes or the complications. So the blood level, the urine test will tell us the kidney damage, urine analysis will tell us the kidney damage, electrolyte urea test will tell us the kidney damage, the blood sugar. The blood sugar is a risk factor. So when the blood sugar is high, it's also you have more risk factors. TB profile, cholesterol. So it's a risk factor. Just actually, we also check the complications on your heart. So those are the things we do. And then, so the lifestyle changes we've already talked about. And then the antihypertensive medication, there are different classes. So I said we'll talk about the alcohol. I think that's the next slide. So the alcohol, that's the picture. So this is the picture. We took a portrait taking alcohol in moderation. So we can see the first one. We can see the spirits, things like whiskey, gin, and all that. It has a higher alcohol, like 40%. We can see, I can see people getting excited. Any problem? The problem? You like the alcohol? It's not good for us. Even in moderation. We can have it in moderation. There's something like standard drink, like to standardize anything you are drinking. So for men, you can't take more than 2 drinks in a day. Like I mean the standard drink. Women one, I'm going to explain that's what I'm trying to I know there is someone so we can see one standard drink. No, one standard drink is still a meal, 3 for 1 meal. See like this here, see the meal. One time. 3 for 1 meal. So that's the standard. You're not supposed to take more than 2 in a day. And your good star, I think start was like 600 now. Start 600, so start already close to 2 drinks. So that means not more than 2 bottles in a day. That's how we get. Yes. For men. Moderation. So the same for the other one, like wine, table wine, the standard rate is 142. Okay. I think we should proceed. Continue. 2 more minutes. Okay. But apart from that, to encourage them, and commonly liver disease is still a problem. Even dependence is still a problem. So there's something called cage question. I think the men are interested to know whether you are dependent. You know, it's addictive. So cage questionnaire. You can even Google it, CAGE question, to see whether you are dependent. One of the questions, speak down. I don't know, 6 minutes is exhausted. Let's see what you know about. Please, when you need that, you can text. And if you can put down your question, so you have to call the last person that for today, then we will. Okay, are you ready? No problem. Hello.
Good afternoon, everyone. I'm happy to be here and to be your midst for the first time. And I think it's a very wonderful atmosphere here for you to be trained and lectured on very, healthcare issues. And I'm sure at the end of the day, you have a very wonderful knowledge about safety. So my name is Dr. Paul, like you said. I know the citation is very professional, but I'm the acting director of program for Plant Parenthood Federation of Nigeria. Plant Parenthood Federation of Nigeria is the Nigerian country program of the International Plant Parenthood Federation African region. We have our headquarters in the United Kingdom, and we are found in 77 countries in the world. And so I currently, PPFN is an organization that is interested in your sexual and reproductive health and rights, which includes family planning, cervical screening, and STIs, and so many other things we delve into nutrition. So my presentation today is our integrated access to cervical screening, prevention and treatment in integrated sexual and reproductive health rights in Nigeria. So PPFN is next slide, please. You can. Yeah. So we were established in 1964, and we are an advocate of sexual and reproductive health rights. We envisage a society where individuals freely exercise their rights and choice of family planning and quality health services. Can you go to the next? Yeah. So we are found in the 36 states of Nigeria. We are found in the 6 regions of the country. We have clinics both in Abuja and locations in the country where we do our activities. Next slide. So we provide integrated and comprehensive sexual and reproductive health and rights services, which is what they call person-centered care. We look at you and make sure that you are part of the decision of your care, and this has to do with your sexual and reproductive health. And we also do our outreaches to how to reach environment, those places that the government cannot reach, we go there. Those people that the government cannot reach out to, we as well go there. And through the funding we get from United Nations Population Fund, United States Agency for International Development, United UK Aid, and Global Affairs Canada, we're able to provide subsidized, services to you, and that is throughout the federation. Currently, last year we got a grant from United Nations Population Fund to rehabilitate hospitals, primary health facilities, family planning unit of Akwa Ibom State Government and Kaduna. So for Akwa Ibom, they have most of their facilities already renovated, that is the family planning unit. Because we know that most governments are not interested in family planning. Most women have to pay out of pocket and all that is offered to really get family planning service. And this is what we have been trying to do in terms of innovation and provision of trainings to healthcare workers. Next slide. So I don't want to bother you with the country context of cervical because my colleague has given you the information. Cervical cancer is the second most popular cancer in Nigeria after breast cancer, and a lot of women are dying for it, and we need to know that. Okay, so next slide. So this is the integrated package of essential services we do: cervical screening, contraception, gender-based violence. Just like you mentioned, rape, we also support women and children and adolescents that are raped, to linking them up to sexual assault referral centers and provide them with all the necessary psychotherapy that they need to really be a good survivor. So we do that. We also provide counseling. We also provide counseling and services. We know that currently in Nigeria, abortion people don't talk about, but so many women do that. It happens. Everybody knows that. Most times when people are raped, it causes pregnancy and there's a need to abort. And all that when things happen, they will go to one case and do something and then come back, become a complication. So we don't want that to happen. Through our funding, we're able to provide the service to young women and anybody that requires safe abortion based on the legal standings of the country. And then gynecological services and all that. Next slide. Good. So one of the approaches we are using right now is called when you mention PIA, that is visual inspection with aseptic aspect screening for cervical cancer. That is why I'm here today. So we partnered with a company in Israel, which is also in the US. We are trying to digitalize, go into digital health intervention in Africa, where they provided us with a scope, a gynoscope, which is called the imaging gynoscope. And that imaging gynoscope is a machine that helps the client, you, to see your service, to see what he presented initially was, and the doctor said to the client, does the thing.
With breast cancer. I think between 2020, my daughter hadn't been to Nigeria for like 3 years. So when she got in, she felt like she was 19 or 20. She wanted to be a baby.
The
So she said, Mommy, you have to
laptop
face
is
me.
this thing now.
I mean, giving you this background story too, make you see that it was just the mercy of God that exposed the cancer that was in me.
Let me see
She
if I will
said
talk
she
to
wanted
her.
me to bathe her, and I said, how can I bathe a big woman? She said, Mom, staying in that London is something is serious. I want to feel like a child. In the process, I almost slipped in the bath, and she held me. When she held me, I experienced some discomfort on my right breast. I believe he gave life. Okay, can I continue? Yeah. So before then, I had noticed that my right breast was fuller than my left breast. No, no, no. Okay, my right breast was a little bit more full than my left breast, but I didn't know how to do that examination. So I told her, I said, I've noticed that this breast is different from this. So she said, oh, let's have a look at it. And when she looked at this, Mommy, I mean, 19, 20-year-old girl will be telling me that You have to stay a doctor. I think there's something. I said, like what? I cannot open my breast and show any doctor at this time. So forget it. She insisted I had to stay a doctor. She left on a Saturday, and by Monday, I decided to make inquiry to know what this was all about. Long and short of it, I went for a scan, and then I was told, oh, that it's just a little lump, that maybe it's just milk collection. I said, breast milk at this age? What type of milk collection? And it wasn't even up to 1 cm. That's what the scan told me. But I decided to investigate further. I called a client of mine who is also a medical doctor in Kano, and he now said to me, you don't have any reason to have any form of lump in your body at your age. So go to National Hospital. This was also I went to National Hospital. I'm sorry to say it, I had a bad experience, which almost even created more complications. But I was later directed to one doctor here, Dr. Maina. It was very hard to get in touch with him. That same doctor helped me to reach out to him. And when I did, he explained to me that I had two big masses. Something they told me my 1 inch. I had two big masses. One was right under, and the other one was under my nipple. But we needed to find out if it was cancerous. Now he couldn't do much. He couldn't do the mammogram because at this time, National Hospital had punctured my breast, trying to get 11 punctures. I'm sorry to say, but it was that's the experience I had with National Hospital. And the thing had become septic. So he now said he can't do mammogram, but we need to do a surgery to bring it out and find out whether it was cancerous. And that's how my journey started. April, I think 2020. Before I could say Jack Robinson, we saw what was brought out of my breast. It's and thereafter, within 5 days, I had to go through how do you call it? The removal of the breast, mastectomy. 5 days because they said it was a rapid growing cancer, very rapid. So they needed, and because of all the interventions or whatever, they needed to pull it out immediately. So I went through that trauma, and under 2 days, so by the next day, he had discharged me from the hospital. Why? He said, no, I need to go to the hospital. It was 2 days to my birthday, my 59th birthday. And he said he shouldn't be in the hospital. I should go home. A great story. About a month, most of you came around, especially this same Sandra. Sandra spearheaded the station to my house, got people to come together, raise funds, and I had to follow through. The major problem I had was going through chemotherapy. The reason is that my father, we have a history of cancer in my family. My father died of cancer, prostate cancer. My uncle, his twin brother, the same thing. My two cousins, my male one died of pancreas, and my other cousin died of breast cancer. So I hated cancer. I didn't want to hear, no, even understand it. And then here I was faced with it. So I said, Lord, I told you my father should die but not of cancer, and you made him die. Me and you were going to go through this together. God made it day after 1 month, after the healing process, and they had removed the metal stitches and everything. I was prepared to hospital in Lagos. One of the doctors talked about going to a good hospital. One is early diagnosis. Secondly is the treatment, where you get your treatment matters. Because in that hospital, I was educated. Me that didn't want to know about anything, and even though they said I had cancer, I didn't want to hear. I didn't want to know details, but I was taught, I was educated, I was exposed to the dangers, the reason I had to go through chemotherapy and all of that. And when I eventually accepted to do that, I went through it heartily. I used to have to go from Abuja to Lagos for that treatment, come back the next day.